Suppose you have a child with asthma. You ask about other things, and they will tell you, my child, boy, who is asthmatic, has a very problematic sleep. So now your mind start to suspect Calicarbonicum, most probably, because you see the combination of problematic sleep, sleeplessness, and asthma. It doesn't mean it must be Calicarbonicum, but it's already in your mind. So you ask about the type of sleeplessness, and mother will tell you, well, it's that the falling asleep is difficult and long. And that's not the type of sleeplessness we see in Calicarbonicum patients, because we usually see the awakening between 2 and 4. And then it takes a long time to fall asleep again, but the first falling asleep is okay in Calicarbonicum. The problem arises between 2 and 4. And it's also the time when in Calicarbonicum we see worsening of chronic or acute complaints. So it's not only time they wake up, it's time when the asthma is worse. But you cannot confirm this. But still, Calicarbonicum is in your mind, so you ask about other symptoms which may confirm Calicarbonicum. So you ask about the emotional state, and you expect that there is not strong emotional pathology, because in Calicarbonicum, apart from irritability and emotions felt in stomach, there is nothing really deep in a way of depressions or strong fears, right? But here, the mother will tell you, that's another point which I'm coming to you, because my child, my son, is very oversensitive. And you ask about the sensitivity, and then she will tell you how sympathetic he is. So suddenly you have information about very excessive sympathy, which is expressed by mother spontaneously, so you have to take it seriously. And you know that Calicarbonicum does not have it. So now, if you are open enough, and you know that it's really strong, so you cannot ignore it, you naturally try to cover it by the remedy, but it's not a part of Calicarbonicum picture. And if your mind is operating in a selective way, your mind will jump to another remedy having sympathy, and maybe a little bit downgrade the asthma, which is not the right approach, but let's say you do this. So you ask about phosphorus, and finally you realize that phosphorus also is important in asthmatic cases, right? And it also can have, and usually have difficult falling asleep. Then you ask about, and you observe the child, because usually children, let's say it's 8 years old boy, and phosphorus children are usually very open, very communicative. But this boy is very shy. Not extremely shy as Berita carbonica. He doesn't hide behind the mother, but he doesn't hold the mother's hands. But he's definitely not communicative. It's not open, right? So it's something which is strange, at least in phosphorus, but maybe he's constitutionally Natrium muriaticum, and now maybe he needs phosphorus as a first remedy. Everything is possible, right? So you ask about other things like fear of thunderstorm, and they will tell you, no, it's okay, thunderstorms are okay, I like it. And then you ask about thirst, and the child has not significant thirst, it's rather thirstless. So you are unable to find not only confirmations for phosphorus, but you have the contraindications. It's not open, it's closed. The child is emotionally closed. There is thirstlessness. There is no confirmation in a way of fear of thunderstorms, which is really very strong in phosphorus, and it's there in most cases, especially in children. So there is, you are not happy with phosphorus. And then you think what to do, and this is the typical situation, how to finally end up in carcinosinum. Okay, so your mind is racing because now Calicarbonicum is out and phosphorus is out. So you try to combine the information you have already gathered from the mother and from the observations, and maybe it may be pulsatile, right? It's thirstless. It's sympathetic. Pulsatilla may be sympathetic, even though not so much, but not so much as this boy, but it's there, you know. You know this symptom from Materia Medica. And why not pulsatilla? It's very important for asthma, especially in asthma which develops after eruptions had been suppressed. So you ask about eruptions being suppressed before the asthma developed. And mother's response is negative. There was no such things like eczemas, nothing like this in history. Then you ask about how easily the boy weeps and this kind of stuff. Nothing. He only weeps alone. And if you ask the boy, he will tell you that sometimes he wants to weep but cannot weep, but the weeping is not so prominent or striking. And once you hear he cannot weep easily, your mind will switch to natrum muriaticum and ignatia. So you start asking about these two remedies and nothing can be confirmed, right? After 1.5 hours of this type of thinking, going through dozens of remedies, but only finding out that each of them is contraindicated. This is the situation. I will start thinking of carcinosinum. You know, the clinical, real practical clinical situation in which you finally confirm carcinosinum quite frequently, not always, but quite frequently, is exactly this scenario. You see fragmented symptomatology. So you see fragments of polychrests, 2 keynotes lycopodium, 2-3 keynotes phosphorus, but at the same time, contraindications to phosphorus, contraindications to lycopodium, contraindications to other remedies. But each time you find a new information, you sense that now you have it. Now, once you have the sympathy, now you have the sense, now I have it, it's phosphorus, right? It combines the respiratory complaints and the sympathy and falling asleep. And then you are very sure with phosphorus, and then you ask about thirst, then you ask about fear of thunderstorms, and everything is ruined, right? You go again, over again, you get another information, another symptom. You have the similar sensation that now you have it. You ask about the remedy you have in your mind, but everything is contraindicated. So at the beginning, you think it's simple case. But as you ask more and more, the more information is given, and all those information are quite specific and important and keynotes for some remedies. But any of those remedies can be really confirmed. And this is the situation. And after 1 hour, if you see this pattern, you have to think of carcinosinum. That's important. These cases I'm talking about now, you can see it in children, you can see it in adults. are not easy cases in general. And these are definitely not clear-cut carcinosinum cases, as we read in Materia Medicas. But in vast majority of cases, when you see this scenario, you will finally confirm carcinosinum very well. But this is the one very important aspect of carcinosinum, which is not well known or maybe well understood by many practitioners, but it is something which is the core of the carcinosinum from this perspective. This is very, very fundamental for this remedy. Now, it doesn't mean there are not easy carcinosinum cases. There are so-called clear-cut cases. But if you take into consideration the very serious family history, a lot of autoimmune diseases, tuberculosis, cancer, a lot of cancer. Now, even from genetical point of view, physiological point of view, you may see how much predisposed this organism is. So it tends to develop a lot of problems quite early in life, and they will give you the idea of many homeopathic remedies. Now, this is not specifically typical for carcinosinum. It's a general feature of difficult cases. But in cases which are not clear-cut carcinosinum cases, this is the practical scenario in which you should definitely think of this remedy, no matter whether it happens in children or adults. So keep it in your mind. So that's the first thing. Now, the part of this pattern is caused by the very strong tendency for contradictory and alternating states. You know, if you have somebody with this tendency to contradictory and alternating states, they will not tell you, "Hi, I'm Petr and I have alternating states," or "Hi, I'm Petr, I have contradictory states." No. You ask the mother about, we're still talking about this 8-year-old boy, okay? So you ask the mother, what about his food cravings? You can even ask the boy, it doesn't matter now. And he will tell you, well, I used to hate chocolate until I was 5 years old. But ever since 5 years old age, I must have chocolate every day. The first thought may be, well, maybe he needed a remedy with aversion to chocolate, which is, by the way, quite rare in children. And it's a keynote for osmium. It's a very small remedy. And maybe in 5 years old age, something happened which forced the organism to change the pattern. So maybe another layer developed at that time. So you ask about other changes during this 5 years old age, but you cannot find anything. There is no etiology, there is no general change of symptomatology. There is only this change in this very specific area. Okay? And then let's say this is the asthmatic boy, right? As I said at the beginning. Okay, then you ask about what makes the asthma better. And they will tell you, we don't know, there is nothing specific. And you ask, what about seaside? And they will tell you, well, it's unpredictable because when he was young, we were in Greece, and it was disaster. we had to go away from Greece earlier because the aggravation at the seaside was tremendous. But we visited the very same place after 2 years, and everything was fine, even better, because during this period when we were in Greece, the asthmatic condition was much better than normal. Okay, and 2 years later, we went to Croatia, knowing that the last time the sea made it much better. But in Croatia, it was much worse. And since then, every time we went to seaside, it was worse. So now we don't visit seaside anymore. So you see a kind of contradictory reaction to the seaside. Even the same place, same country, everything was the same. But one time it reacts very well, and another time it reacts very quite opposite or very opposite. Every time there is definite reaction, sometimes very positive, sometimes very negative. So that's why they tell you there is no specific thing. But if you ask about the sea, they will tell you sometimes very bad, sometimes very good. And now you connect it with the chocolate. You see how tricky homeopathy can be, because you think it's these are two different things, but it's completely same pattern, right? In chocolate, you saw the exactly same thing. I hate it, I love it. In asthma, worse at the seaside, ameliorated at the seaside. But nothing is stable. And this is one of the things which make the case so rich on symptoms, but at the same time very confusing. So this is exactly how contradictory and alternating states modify the picture, making it less clear, more confused. Even though you have specific information, you don't see the remedy covering this wide range of picture, the wide range of symptoms, because if the mother tells you he is much worse at the seaside, or he was, you will think of CPA, you will think of tuberculinum, you will think of natrum muriaticum, etc. Now, he is much better. Maybe he needed CPA or natrum muriaticum, but now if he is much better, he needs another remedy, bromium, medorinum, whatever. So you ask about bromium, you ask about medorinum, you ask about CPA, natrum muriaticum, etc., but you cannot confirm anything, right? Because for natrum muriaticum, he's too much sensitive. He's too sensitive to criticism to the degree which is completely absent in natrum muriaticum. And there are other similar reasons why it cannot be CPA, tuberculinum, etc. So this is situation, this, what I have described already, which you have to ask about carcinosinum. Okay, you see this, you try confirm remedies one after the other for 1 to 1.5 hours, and then you understand how this pattern is. What specifies this pattern is this. I don't have a one name for this, but this is how I perceive it in my practice. So you ask about carcinosinum because you know it's typical, because now I'm telling you it's typical, right? So it doesn't mean you will give carcinosinum just by seeing this scenario, because seeing this scenario may be the truth true in cases which are difficult, but they need small remedy, let's say. So it doesn't mean it is always carcinosinum, but you have to think of carcinosinum in these cases. Carcinosinum and small remedies. If it's not carcinosinum, you will not confirm it. So you will find very easily if it is or if it's not carcinosinum. But you have to think of it. That's the point. Once you know carcinosinum has this, you recognize this, you will ask for carcinosinum, right? You already have all information about the patient, but you don't have the remedy covering this case. Because each remedy covering part of the symptoms are keynotes for each of those given remedies, but all of these remedies are contraindicated or they are not fully confirmed. Now, if you are in such situation, you have to ask for carcinosinum. And the first is family history of cancer. Usually, there are multiple people in a family who had cancer. Some of them in very early age, some of them repeatedly. Ask about this. Now, if you have this scenario which I have described, and together with this, at the same time, you confirm the strong family history of cancer, meaning 1 or 2 people, very early age, 30, 40, 50 maximum, okay, with cancer, then it's very likely you will confirm carcinosinum when you will keep asking further. Once you have carcinosinum in our imaginary case of 8 years old asthmatic boy with difficult falling asleep and the asthma, and you confirm the family history, which you ask about after 1.5 hours because you was unable to confirm anything else, but there are several keynotes for several polyhedrets without definite confirmations or with contraindications to any of them, to all of them. Then you confirm the family history of cancer. And now you understand and you remember that carcinosinum is really important remedy in asthmatic children, especially with this history. And it's a very keynote for this remedy to have difficult sleep, especially falling asleep. Now for this remedy is very characteristic that sleeplessness is of this type. They cannot fall asleep easily. It can take several hours before they are able to fall asleep. You have to ask since when they suffer from this kind of sleeplessness. And the mother will tell you since they were born. Now it starts making sense because now you know that carcinosinum has the combination of the main complaints with exact background, with exact context that it was since he was born. And at the same time, you were able to confirm the family history of cancer at a young age, at early age, usually in multiple people. So now you think, I have it, but you are still quite careful because you had the same feeling with phosphorus, right? And other remedies, calicarbonicum. Now, if you know carcinosinum very well, you will observe a child and how mothers behave while the child is sitting next to her. The thing is that you may get a lot of symptoms just by seeing the child, by observing the child and by observing the mother when it's carcinosinum. When the child needs carcinosinum, the first is, this can be clearly seen, freckles on the face. Sometimes moles in the face, but moles, you cannot see the numerous moles which are usually on the back. You have to ask the mother, but freckles on the face and on the neck is something you will see very, very frequently in carcinosinum. This is the rubric. And although carcinosinum is missing here, you have to put it here. It may be phosphorus, lycopodium, and sulfur. It's correct. It's according to Materia Medica. But carcinosinum is missing here, and it must be here. Now, another thing. Extreme sensitivity to criticism. Of course, you may ask about it. You ask, is your child oversensitive to criticism? And if it's carcinosinum child, and you must ask, if it's carcinosinum child, this symptom will be 3 times underlined. It will be very intense and very frequent. It will be there in very high intensity. The son is very sensitive to criticism. She will tell you, don't you mind, I would send my son to waiting room? Can we speak just you and me? You say, of course, yes, no problem. So she sends the son into the waiting room, and you naturally expect she will tell something horrible, some kind of family secret, right? But she will not tell you anything special. I mean, no, nothing what in other children will be disturbing. She will tell you, and she will tell you by silent voice, because she's afraid that maybe the boy can hear it through the door, even it's closed. She will tell you, my boy is very sensitive. He weeps when I cannot say anything, right? But sometimes she will not tell you this. She will tell you, she is so perfectionist. And that's it. And you ask, and what? And she will tell you nothing else. She's very perfectionist. And you cannot understand why she sent him out of your office just to tell you he's perfectionist. It's not criticism in a real sense. But she knows, the mother knows, that if she tells this, even this, in front of the boy, he will take it as criticism. He will translate it, I'm not good enough. Something is wrong. I'm perfectionist, and that's why parents don't love me so much, right? That's the psychological pattern of the child. And maybe mother cannot explain it by these words, but she sends it, right? Because she knows the boy. So she sends him out. She tells you something really innocent. And you cannot grasp, you cannot understand why she sent him out. If you are not experienced homeopath, you will never connect these two things. You will never get the idea why she sent the boy out before she tell you such an innocent thing. But if you are really observant, if you are experienced, if you are advanced practitioner, you will not miss it. Even if you don't have carcinosinum already in your mind, if you see this scene, you must have it. Because the only reason why she sent him out, because of such an innocent thing, means he's really, really sensitive to even slightest thing which is spoken about him. And then you may ask, once you see this, you may ask directly, why you sent him out to tell me such an innocent thing? You can be really honest with the patient, or with the mother in this case. And she will tell you, well, I know how sensitive he is. If he is present here while I'm telling he's perfectionist, he will think about it the next few days, he will weep. He will become very critical to himself. I don't want to hurt him. If you hear this from the mother, you don't need to ask anymore about sensitivity to the slightest criticism, because this is exactly what the sensitivity to slightest criticism means. So if you are really observant and something like this happens, and it will happen, I assure you, because I've seen it dozens, maybe hundreds of times, then you will see this symptom. You recognize the sensitivity, and then you put it together with falling asleep difficult and asthma in children. And even if you don't already, if you still don't know about the family history, this alone with freckles in the face, or even without freckles in the face, just this single symptom, together with combination of difficult falling asleep or since he was born, will give you clear idea about carcinosinum, or of carcinosinum in this case. And then you will ask more further about all this stuff, right? These children are usually, they are very perfectionist. Their inner state is, if I do my work perfectly, my parents will love me. If I don't do my duties perfectly, they will not love me. They will not openly ask them about love, but they are very affectionate. They are very affectionate. They have a strong need for affection, embracing, kissing, all this stuff excessively, especially cuddling and these kind of things. These people are very contact people. Especially children are very contact children with parents. They need physical contact, physical affection, physical affection. That's why it can be very, very easily confused with phosphorus. But phosphorus does not have this desire to be perfect. The desire to be perfect is something which is a keynote for carcinosin. They need to be perfect because they believe they don't deserve love unless they are perfect. And if somebody will tell you this, I'm perfectionist, and I think and I believe I must have everything perfect, and this is only condition I can be loved by others. It's usually from books, from seminars, from YouTube, etc. But this is not trustable if somebody has it kind of, it's like they memorize it somehow, or they read it somewhere. But what I have already described is a real natural expression of these symptoms, right? Mother is aware of the sensitivity all the time, and she tries to protect her son, and she does it by sending him out when she expects you to ask about her psychological state, or if she wants to give you some information. And by sending her out, you expect something very, strong will come, something very difficult will come, something very, heavy, really severe or serious. But nothing like this. Just, he's perfectionist. That's it. And you cannot understand why he had to leave the room. Okay, another point. Precautious regarding their development. Although precocity is not a keynote for carcinosinum, you may see both. You may see development affected by opposites, right? It may be child which is or who is slow in development, or you may have precocious child. You can see both options in Carcinosinum children. So it's not a keynote, it's possibility. In some Carcinosinum children, more Carcinosinum children are precocious than slower in development. So bigger percentage is precocity. Lower percentage is slow development. But in the precocity here in Carcinosinum children is usually expressed through from very early age, in meaning that they, especially talking, is very fast. Not they are loquacious or talking fast, but they learn to talk very fast. So let's say in 1 year old, they can fluently speak, difficult sentences, right? Not only few words or simple sentences like children in this age, but the very complex sentences. And you may see this if you have a child who is, let's say, 5 years old. You will see this speaking is much more advanced than in other children if you have comparison of the similar age. If the child is older, let's say 10 years or 8 years, you may always ask the mother about the precocity on the level of speaking. And in most cases, you will confirm if Carcinosinum is the remedy. Not in all cases, but in most cases, you will confirm that the precocity of speaking especially is there. Another thing which is connected with the sensitivity to criticism is they are easily offended, and that's the reason why also together with sensitivity and being offended are the two sides of the same coin, and that's why the mother sent the child out of the room, because she knows about these two things, right? And of course, cafe latte spots, you may see it, but usually they are not located on the face. They are usually on the abdomen or back or legs, sometimes in the upper arms. So you have to ask about this, the mother. But don't expect to have cafe latte spots in every case. You have it in some cases, you don't have it in other cases. Okay. The list of complaints is really huge, but usually the sleeplessness is there as concomitant from the very beginning. So whatever they have, the sleeplessness is the part of it, especially falling asleep, very difficult. Asthma is quite common condition in Carcinosinum children, and also frequent colds. They can even have the history of very serious conditions, acute conditions in the very early age, like pneumonias. And also they usually have the some typical signs regarding or connected with mononucleosis. And they also, or you also have to think of Carcinosinum in any problems which started after mononucleosis, chronic complaints which develop after mononucleosis, right? They usually start being more deeply sick at puberty, but the sleeplessness is there from the very beginning, and asthma is there usually in early age. So if you see, if you take into consideration all we have spoken yet, you have to think in Carcinosinum if you see any combination of anything what we have already discussed. Now, if you have the Carcinosinum in your mind, then you have to ask further. The hypersensitivity to criticism, strong need for affection in children. It's a very important point is this, childhood diseases, they are either they don't have normal course. They may be completely absent, which in this age is quite normal because of vaccination. But if this is unvaccinated child, the diseases, childhood diseases, come very early or very much later, and they are either very mild or very severe. So, for instance, in children, you have history of chickenpox, and you ask when it came, and the parents will tell you it came when my boy was, let's say, 7. It's quite later. It's quite later than you expect. But it's not as clear as if somebody will tell you, I have chickenpox when I was 25, right? It's really rare. So at 7 years old age, it's not so rare, but still it's a little bit later than expected. But if it came at time when it's not so clear regarding when it came, you may always ask about the course, and the course may be really much milder. So, for instance, chickenpox, just few pimples and almost no itching, right? Or it may be really severe, whether it came early or later. It may be very, very mild, much milder than usual, or much more severe than it's common. So this is something you must ask for or ask about. And if you confirm any of these scenarios, it's confirmation for carcinosinum. These children are very responsible because they are afraid of making mistakes in anything they do, because they believe that if they don't do things perfectly, they will not be loved by parents. So they do everything they can to be perfect, specifically as regarding school. Very responsible, very duty-bound. So they may look at other remedies which are duty-bound, like natrum salve, let's say. And they behave in 90%, 99%, they behave very correctly, right? They are very sensitive. They are not demanding. So they are well-behaved children in most cases. So they will remind you natrum muriaticum, which is also very well-behaved. They will remind you calicarbonicum because it's very duty-bound. Okay? They will remind you phosphorus because they are highly sympathetic, but they are not open. They are much more sensitive because phosphorus is sensitive, but they express emotions very easily. And they are not so sensitive to criticism, phosphorus. They may take criticism, they express the feelings they have after criticism, and they are okay. In carcinosinum, criticism can be there inside them for months, for years, and creating extreme suffering, right? They have a lack of self-confidence. When they criticize, they may weep, and they usually weep when they are alone. And they may usually say, and that's another thing which you may observe, they may usually, or they will say it during the consultation, or mother will tell you while describing the child's behavior, that when the child is criticized, they will criticize themselves more. So mother will tell he is perfectionist, and if the child hears this, he will tell bad things about himself, right? Like, I'm dumb, I knew it, I knew. And mother will tell you, no, you are not. But he will be sure he is. Okay? So that's something which is really typical. But because of all these symptoms, which reminds you many polyhedras, it's very easily confused with phosphorus and causticum because of sympathy, with natrum sulf because of duty boundness, and cypea because there is, in some cases, there can be very strong aggravation at the seaside. And cypea are also children who are sensitive and close together. So, and they love thunderstorms, both. So it's quite typical to confuse cypea and carcinosinum in children. And if you think of carcinosinum, but the sensitivity to criticism is not there, definitely think of cypea. Because most probably cypea will be a better option for the child who looks like carcinosinum, but without so much sensitivity to criticism. Okay, regarding repertory, sleeplessness in children, you see this is one of the major remedies here. And family history of cancer, this is most important remedy. Sensitivity to criticism, most important remedy. And this is very important rubric. Admonition, which is kind of criticism, aggravates. Even kindly, which is the rubric corresponding with the situation I described to you. Carcinosinum is here. But don't get fooled by repertory because you see phosphorus is here in second degree. But in reality, phosphorus is never as sensitive to criticism as carcinosinum. So carcinoma is the most important remedy in this rubric.